Hi everybody, I am Dr. Aminuddin Owaisi. I am a consultant interventional cardiologist at Care Hospital, Nampally, heart failure specialist. And today I am speaking to you about a topic called, an important topic, which is hypertension, BP. In what is, it's how it's termed in the layman's or in the with the common people. So everybody, I think, knows that about heart hypertension. They know that elevated blood pressures are not good. Anybody who, usually most people who have elevated blood pressures and they've checked it at a clinic or at their local doctor or in a hospital, they usually end up start taking medications for it. Sometimes those medications are not adequate enough, and what happens is people then they have, or sometimes they have not been diagnosed with blood pressure, and they experience pain in the chest or shortness of breath, and they come to the emergency, and the BP is usually around above 180, 200, very high BPs. And why I want to speak to you about this is because this is a particular topic called as accelerated hypertension, and that where the reasons for that are many, but what is important is to get immediate treatment for this and lower the BP, because if the BP stays very high, then there is always a risk that the patient may end up getting a bleeding manifestation, especially in the brain. They may experience some kind of hematoma in the brain, or they may experience some other issues which can cause them to have a paralysis, or even they can experience heart failure, because usually people with elevated age and mild coronary artery disease, when the BP is very high, the heart has to work against the blood pressure, and it has to work really hard to maintain the flow of the blood, and that can also lead to heart failure. So I think what happens is, a patient with a very elevated hypertension, especially resistant, who is already on a drug, one or two drugs, usually needs to come to the hospital and take IV medications to improve the BP, bring it to a lower level, and also to find out what is the reason, because blood pressure sometimes has certain causes, usually which can either be in the kidneys or due to some coronary artery disease or some other reasons, and that has to be investigated. We need to find that out and we need to fix it, because in case a person has elevated blood pressures for a very long time, even if it is not too high, even if it is marginally high, and it stays like that for a long time, he is at a higher risk of getting heart attacks, he is at a higher risk of getting CVAs, infarcts in the brain, he is at a higher risk of kidney disease and many other problems, especially atherosclerosis, which is the hardening of the arteries of the body. And so today I think I want you to know that if in case any of you experiences BP which is resistant, he is already on a medication, please come to the cardiology. BP is now being considered as a cardiac problem more than just a general medicine problem. So come to the OP, or in case if you are experiencing very high BPs, come to the hospital as soon as possible, and we have all the facilities available, and we can always take care of this. Thank you.